Everyone, today we will talk about Aethusa cynapium. So, if you are talking about Aethusa, then Aethusa is basically the medicine of children. Obviously, it can be used at any specific age, depend on the specific symptoms. But talking mostly, then Aethusa is mostly used in the children's. This is called children's medicine, and the common name of Aethusa is fool's palsy. Now, mostly if we are talking about the ailment of Aethusa, the season of Aethusa, then Aethusa mostly used in the summer or during the dentition period in the children's. If you are talking of ailment, then mostly it is used in the summer or during the dentition period. Now, here is the contrast in the Aethusa. The Aethusa is basically mentally and physically so much dull, so much weak, so much prostration feeling in the Aethusa. But if we are going to talk about the disease state, the intensity of the symptoms, then the intensity of the symptoms of Aethusa is so much high, so much severe the symptoms of Aethusa, so much high. If we are talking further, then we will see the cholera symptoms, so much intensity, very high intensified symptoms. Now, we have talked that mentally and physically Aethusa is dull. So, the physical symptom, if we see, then Aethusa is so much dull that he cannot hold their head, the weak neck due to their weakness in the leg. So, Aethusa basically cannot hold their head, and same physical problem, you know same physical weakness also runs in their git symptom, that the stomach symptom, basically that is cholera infantum. Now, if we are broadly talking about the sphere of action, then it can be at every part or any tissue, but mostly intensified at git, that is cholera, epileptical symptom of Aethusa, and at the brain level, that is brain fag. Now, we have seen the weakness of the Aethusa, that he cannot hold their head due to the weakness of neck. Same weakness, same unhold feeling occurs inside the GIT, that the patient of Aethusa, the child of Aethusa, cannot hold the milk inside the stomach. So due to that weakness, they have to eject their milk either in the form from the mouth or either through the rectum. So if it pass the milk through the mouth, they have an curdly vomiting of the milk, the famous hard, very large curd vomiting of the Aethusa. And if it goes through the rectum, due to the weakness of the git level, then it will going to be cause cholera infantum. Cholera infantum, Aethusa is most prominent medicine in the cholera infantum. Now, it has a peculiar sign, a very different sign in the cholera phase. It has a basically cycle. So here two most important thing, that during the cholera phase, the basically will be complete absence of thirst. Absence of thirst is very marked in the Aethusa. And if we are going to follow the cycle of Aethusa, then basically child drinks milk. Now when the child drinks milk, now due to the prostrations of the git, it vomit, and same prostration continue. If after vomiting there is so much prostration in the child's body, that he is going to sleep, he start to going to be sleep, and after sleep they wake and again get hungry. See the cycle: child drink milk, then vomit, go to sleep, then again wake, again get hungry, when again milk, and the again vomiting. This is the cycle of Aethusa going to be continue and continue. Along with this cycle, if there is the great thirstlessness, then Aethusa is a direct medicine in the cholera infantum. Now, same weakness, same prostration occur in the sleep, Aethusa child. Now, if there is so much prostration, then child will always feel sleepy. Now, sleepiness can be after any disease, like either can be stool, either can be cholera, either can be after vomiting, and can be even sleepy feeling after the spasm. Now, some uncommon symptoms of the Aethusa is that appetite increase after the phase of vomiting. That if a baby of Aethusa vomit the milk, then its appetite will increase, they will feed again, and the cycle will goes and on. We have just talked earlier. And the prominent vomiting of the Aethusa is in the large curd, the classical large curd vomiting of the Aethusa. And all the intensital symptoms of the Aethusa is so much high that can be, so much violent pain, violent convulsions, violent pain during cholera infantum. Now, this is the basic GIT symptom of the Aethusa, so much oftenly used in Aethusa. Now, if we go further on the epileptical symptom of Aethusa, in children's, uh, Aethusa is also very good medicine if we talk about the epilepsy. And the main prominent symptoms of the epilepsy in Aethusa is, basically clenched fist, clenched thumbs, basically child fold their thumbs, and face will be basically red and eyes turned down. The most prominent symptom will be, see here, the face is particularly, red like belladonna, the redness of the face. And the most important symptoms during the epilepsy is the eyes. See here, the eyes are basically downward and frothy epileptic form, and locked jaw become basically locked during that phase. So if you're talking about the Aethusa epilepsy, then the prominent symptoms are epileptical spasm with clenched thumbs, face red, basically red. See the figure, so much red face with frothing, jaws locked. This is the basic feature of the epilepsy of the Aethusa. If you are going to treat the infants, there we cannot talk about the classical constitution, because uh, that is, so much typical. So at if the epileptical feature of this the child, then we can think of Aethusa directly. Now if we are going to talk about the third sphere of action, that is examination brain fag, then Aethusa is basically the symptom having lack of concentration. The patient of Aethusa will complain that I have concentration lack of. And there are also some medicine, and we are going to differentiate them. Like Aethusa, most complaint will be lack of the concentration, while argentum also go in the brain fag. But the classical feature of argentum nitricum, that is so much impatience, hurriedness, fear. And similarly, talking about the gelsemium, gelsemium basically what? Drowsiness, heaviness, thirstlessness with the brain fag. This is the classical symptoms of the gelsemium. Drowsiness. Caliphos basically go in the sleeplessness phase. Sleeplessness. Doctor, from when I have started to study for a recent exam, my I'm going to be insomnic phase. My sleep is all gone. I cannot sleep. And in spite of just opposite, the picric acid feel so much sleepiness. Doctor, from when I have listened about my exam, then from that I am feeling so much sleepy. Whatever the time, if I sleep for 12 hours, then also I feel sleepy. This is the classical picric acid examination funk point. And anacardium will complain, doctor, whatever I study, I usually goes to forget, I cannot remember for a long time. This is anacardium's forgetfulness. Now if we're talking something more about the physical symptom of the Aethusa, then Classical symptom of the Aethusa is, old looking, disease faced, and that disease face also known as Hippocratic face. This is a classical image of Hippocratic face. If you are see the image, you think how long the patient has been suffering from the disease, and if you see the expression, that is anxious expression, the face is drawn. The other symptom of the Aethusa is, if you clearly see the image, then the eruption is prominent at the tip of nose. In children, if there is slight eruption at the tip of nose, then we can also think of Aethusa cynapium. The nausea is so much deathly. I have already talked. Violent symptom of Aethusa. See the diversity. Physical plane, mentally and physically, he is so much dull. But the intensity of the disease symptom is so much high. This is the contrast in Aethusa cynapium. Now, if we're talking about the similarity, Aethusa basically resemble antipode in the GIT symptoms. Calcaria in abdominal complaint, and cicuta. Cicuta is a prominent medicine in the epileptical disease. So, along with the cicuta, Aethusa can be also think in the children's epileptical disease. So, till now, we have approximately talked about the physical complaint and sphere of action of the Aethusa. Now, if we are going to talk about the mental, now think Aethusa is basically a children's medicine, infant medicine. So where they are not so much mental of the Aethusa used clinically, but those symptoms which have been used in adult, that is like strong animals lover. Aethusa is basically a animal lover patient. See, so much love for animals, and obviously prostration of the mind, so incapacity to do any type of mental work, incapacity to take any mental work he cannot take. Reserve, the most prominent diathesis, the constitution of the Aethusa is reserve, and it is said that all the reserve patients have special affinity, special love for animals, for nature, for art, because in opposite way they cannot hurt them, like Natramure, Ignatia, Carcinosin. They also have a strong affinity, strong love for animals, because in return animal does not going to be hurt the patient. So it is said that all the reserve medicines, all the introvert medicine have special love for animals, natures. And Aethusa have a different type of delirium, that rats are running in their house. This is has been seen in some patient during the epileptical stage, in epileptical form. Now, due to the reservedness, Aethusa have strong emotions, but obviously they cannot express them, and that's why, due to the non expressions of the feelings, the emotions, they usually cry. But the cry of Aethusa, the weeping of Aethusa, is basically in the house, not in the front of anyone, like Pulsatilla loves to weep in the front of everyone, but Aethusa will weep lonely, like Natramure also grieve in lonely, not in the front of everyone. And somewhat the mental state of the children resembles to Baraita, barium carbonicum, idiocy in the children, incapacity to think, confuse. So basically Aethusa is an acute medicine not given constitutionally. So acute phase of the Aethusa is mostly on the GIT, that is going to be create cholera infantum in the brain fag and in the epileptical form. So these three sphere of action, that is basically acute manifestation at which Aethusa is so much used. And 50 to 70% of children's cholera and vomiting alone can be deal with Aethusa cynapium. And if we're talking about as age wise, then first medicine should use in lesser age, less than 1 year, that is Aethusa. And when the child grows, then the Aethusa is complement by chamomilla and cinna. This is age wise distribution of prominency of the medicine. So this is all about Aethusa. Thank you everyone.